Autism was first described in 1943 by Austrian-born psychiatrist Leo J. Kanner. His early published work discussed the observed behaviors of 11 children, all of whom were patients in his clinic at Johns Hopkins. This disorder was initially referred to as Kanner's autism. The realization that autism is a spectrum disorder, meaning a diagnosis with a range of manifestations and degrees of severity, did not emerge for several more decades. Individuals with autism exhibit a range of symptoms and behaviors. As autism-related diagnoses began to emerge, the new descriptor, autistic spectrum disorders, or ASDs, came into use. In these programs, we will generally use the more common term, autism. The essential features of autism are impaired social interactions, delayed or unusual communication styles, and restricted or repetitive behavior patterns. While autism is approximately 4 times more common in males than females, it occurs in all cultural, racial, and economic groups. 3 recent large-scale epidemiological studies show the incidence of autistic disorders to be 5.8 to 6.7 children per 1,000. The intellectual abilities of people with autism vary from the gifted to the severely challenged.
Okay, remember when we talked about the tens? So what's the tens here?
Many people with autism have unusual ways of learning, paying attention, or reacting to situations or sensations. They may repeat some behaviors over and over, and often have great difficulty changing their daily routine. Autism persists throughout the lifespan, and an understanding of the disorder is particularly important for anyone in the fields of healthcare or education. People with autism, like anyone else, become ill and require medical treatment. They also need and have a federally mandated right to an education that will assist them in becoming a productive member of society. Children with autism may have problems initiating or sustaining a conversation.
Pick up the P, please.
P.
Echolalia is also common. They repeat words others have said, often called copycat speech, or repeat sounds from the environment. The child may create a repeated script from favorite cartoons or video games. Some develop idiosyncratic language. This refers to creating terms to describe objects or other people. This may take the form of gestures, sounds, or words. They may develop language rituals, such as having the parent say a specific phrase in an exact way before the child can perform the requested task, such as getting out of bed.
Daddy needs Victor to get up out of bed and go to the kitchen for breakfast, please.
Some have no speech skills at all. Parents may report thinking their child was deaf because of a lack of response when spoken to.
Hey, Victor.
He hungry. He want donut.
Many individuals have impairments in the use of pronouns, misusing words such as you, me, him, and her when referring to themselves or others. Some can speak, but do not use language as a means of communication.
We're going to talk today about leaders in our class.
Others insist on applying very literal and specific meanings to words. They have difficulty with words that have multiple meanings or pronunciations. In his work, Dr. Kanner referred to autistic children as having an anxiously obsessive desire for the maintenance of sameness.
L-E-A-D, lead. Lead is a metal.
In 1980, autism was designated as a disorder in the Diagnostic and Statistical Manual of Mental Disorders, known as the DSM. The current edition, the Diagnostic and Statistical Manual of Mental Disorders, 4th edition, text revision, known as the DSM-4-TR, lists 3 categories with a total of 12 criteria. Criteria from Category 1 address impairments in social interaction. Category 2 addresses communication impairments, including lack of make-believe and imitative play. Category 3 looks at repetitive and stereotyped patterns of behavior, interest, and activity. To be diagnosed as autistic, the child must have a cluster of symptoms as defined in the DSM-4 TR. Specifically, the child must manifest a minimum of 6 traits, with at least 2 from Category 1 and 1 each from Categories 2 and 3. Some symptoms of the disorder must also be present prior to age 3, and the manifestations must not be better accounted for by Rett's disorder or childhood disintegrative disorder, 2 autism spectrum disorders, which will be discussed later in this program. There are a number of red flags that indicate the possibility of autism. The child does not respond when called by name and cannot tell the parent what he or she wants. Language development is delayed. The child doesn't follow directions and may appear to be deaf. The child does not point at objects of interest or wave bye-bye. He typically makes poor eye contact. When he does make eye contact, it is more like an inspection rather than a communicative tool. He seems to be in his own world, tuning people out. The child doesn't smile socially and seems to prefer to play alone. He may throw frequent tantrums, especially when faced with change. He may be hyperactive, uncooperative, or act defiant. They may not seem to know how to play with toys, or there may be an unusual attachment to a specific toy. Some line objects up and become upset if someone moves or rearranges them. His attention appears to repeatedly become stuck on something. Toe walking, hand flapping, and other unusual motor movements may be seen, as well as oversensitivity to certain sounds or textures.
They're fighting each other in this, Victor.
I really appreciate your being here, Mrs. Graham. Tell me what's going on with your son.
I have a 2.5-year-old son, and I made time to come in today because I'm really concerned about him. He's not where he needs to be, and I started noticing things.
There are a few observations that are absolute indications for an immediate evaluation of the child. These are no babbling by 12 months, no gesturing, such as waving bye-bye, or pointing at objects or lights by 12 months, no single words by 16 months, no 2-word spontaneous phrases by 24 months, loss of any previously attained language or social skill.
Victor, pay attention. 20 plus something equals 80. You looking? Come on, right here. 20.
It is estimated that up to 68% of children with autism disorder are cognitively challenged. However, the presence of any developmental disorder often impairs interaction and communication in ways that make it more difficult to accurately assess intelligence.
90. Okay, so we know it's not 70.
5 diagnoses are included in autistic spectrum disorders. In addition to classic autism or autism disorder, there is Asperger's disorder, Rett's disorder, childhood disintegrative disorder, and pervasive developmental disorder not otherwise specified, referred to as PDD-NOS.